Projection for shoulder girdle. Projection for shoulder girdle. Projection is AP projection, external rotation. Body part, hand in supination. Perpendicular to a 0.1 inch inferior to the coracoid process. Makikita po dito ang greater tubercle ng humerus at site of insertion of supraspinatus tendon. Pagilid po ay sir. Sud ka pre. And then susupinate po ang ganyan. Medyo ipapa-abduct natin. Ayan po. Next projection is AP pa din pero neutral rotation. Makikita po dito ang posterior part ng supraspinatus insertion which sometimes profile small calcific deposit not otherwise visualized. So, internal rotation po natin siya. Ganyan po. Next naman po is internal rotation. Makikita po natin dito ang humerus in true lateral position. Ganito po. Internal rotation. Ganyan po siya. Next projection is transthoracic lateral projection, Lorentz method. Perpendicularly directed mid-coronal plane at level of surgical neck. Lateral, ang makikita po dito ay lateral image of shoulder seen in proximal humerus, scapula, clavicle, and humerus projected over the shoulder. Lang po ang ating kamay. Pupatong po sa ating ulo and patagilid po ano. Patagilid. Yan po. Next projection for glenoid cavity, AP oblique projection Grashe method is to show joint spaces between humeral head and glenoid cavity. Next projection for glenoid cavity is AP oblique projection Apple method. Patient po natin ay weight bearing. It is to show the scapulohumeral joint. Projection is infero-superior axial projection Lorentz method. CR and RP is directed 15 degrees towards the shoulder through the axilla. So, directed 15 degrees papunta sa shoulder. Next projection is infero-superior axial projection, Ruffert et al. Modification, directed 15 degrees. Same lang pero yung kanyang kamay is naka-rotate. It is to show the heel sacs compression fracture on the posterolateral humeral head. Naka-rotate po ang kanyang kamay and then same pa din po. This projection is infero-superior axial projection West Point method, directed at dual angle of 25 degrees anteriorly and from the horizontal 25 degrees medially. The central ray and approximately 5 inches inferior and 1 1/2 inches medial to the acromial edge. Exit the glenoid cavity. It shows the humeral head projected free of the coracoid process. Projection is infero-superior axial projection Clements modification, horizontally directed in the mid-coronal plane, passing through the mid-axillary region of the shoulder, 5 to 15 degrees medially when arm cannot be abducted. Shows the shoulder joint. Projection is supero-inferior axial projection. Angled 5 to 15 degrees through shoulder joint toward the elbow. A greater angle is required when patient cannot extend the shoulder over the IR. It shows the joint relationship of proximal end of humerus and glenoid cavity, the AC articulation. the outer portion of the coracoid process and the point of insertion of subscapularis muscle and teres minor muscle are shown. Next projection is scapular Y, PA oblique projection, raw or low position, perpendicular to scapulo-humeral joint. An oblique image of shoulder. In normal shoulder, the humeral head is directly superimposed over the junction of the Y. In anterior subcoracoid dislocation, the humeral head is beneath the coracoid process. In posterior subacromial dislocation, it is projected beneath the acromion. So, dito po. Projection for supraspinatus outlet, tangential projection. Near method. Angle 10 to 15 degrees caudad entering superior aspect of humeral head. It shows the posterior surface of acromion and the AC joint identified as superior border of coracoacromial outlet. Next projection is AP projection. AP axial projection pala. Directed through the scapulohumeral joint at a cephalic angle of 35 degrees. The axial image showed the relationship of head of humerus to the glenoid cavity. It is useful in diagnosing cases of posterior dislocation. Is proximal humerus AP axial projection, striker notch method. Angle 10 degrees cephalad entering the coracoid process. It shows the posterior superior and posterolateral areas of humeral head. Next projection is glenoid cavity AP axial oblique projection, GART method. Angled 45 degrees caudad through the scapulohumeral joint. Yan po, parang nagpapanatang makabayan po tayo. And then 45 degrees caudad. Projection is intercubital bicipital pala. Intercubital bicipital groove tangential. Angled 10 to 15 degrees posterior to the long axis of humerus for supine position. This image profiles intertubercular groove free from superimposition of surrounding shoulder structures. Projection is intertubercular groove Fisk modification. Perpendicular to the IR, when patient is leaning forward, vertical humerus is positioned 10 to 15 degrees. Structure shown is tangential image profiles the intertubercular groove free from superimposition of surrounding shoulder structures. Next projection is AP axial projection, Alexander method. Directed to the coracoid process at the cephalic angle of 15 degrees. This angulation projects AC joint AC joint above the acromion. Resulting image shows the AC joint projected slightly superiorly compared with AP projection. Then 15 degrees. Projection is AP projection. Perpendicular to the midshaft of clavicle. This projection show image of frontal image of clavicle. And yan po sa mid. mid-shaft of clavicle. Next projection is AP axial projection, lordotic position, directed 0 to 15 degrees valid for standing and 15 to 30 degrees for recumbent, mid-shaft to the clavicle. Mid-shaft of clavicle. An axial image of the clavicle is projected above the ribs. Yan po. Projection is PA projection. Perpendicular exit the midshaft of the clavicle. Structure shown and evaluate criteria are same as for AP projection. Next projection is PA axial projection. The central ray is angled 15 to 30 degrees coded. Structure shown and evaluation criteria are same as described previously for AP axial projection. Next projection is AP projection, perpendicular to the mid-scapular area at a point approximately 2 inches inferior to the coracoid process. AP projection of scapula is shown. Next projection is lateral projection, perpendicular to the mid-medial border of protruding scapula. Lateral image of scapula is shown by this projection. The placement of arm determines the position of superior scapula that superimpose over humerus. So ito yung protruding scapula niya. Ayan po. Projection is AP oblique projection, perpendicular to the lateral border of rib cage at the mid-scapular area. Structure demonstrated. This projection show oblique images of scapula free or nearly free of rib superimposition. Ganito ka po. Hawak ka po dito sa harap. Yan po. Projection is coracoid process axial projection. AP axial projection. 15 to 45 degrees coded posterior superior region of shoulder. Structure demonstrated a slightly elongated inferior superior image of coracoid process is illustrated. Next projection is tangential projection, Laker-Perkin method, directed through the posterior superior region of shoulder at an angle of 45 degrees coded. A 35 degrees angulation suffices for obese and round shoulder patient. The spine of the scapula is shown. Profile is free of bony superimposition except for the lateral end of clavicle.